Levine was going to be here, and I think probably due to the governor's budget address yesterday, they moved the press conference to today. And of course, Dr. Levine is front and center on most of the governor's press conferences right now around COVID. So he asked if he could come next week, and it was. Yeah, so kind of we figured out what we could do. I know that Commissioner Hutt was also scheduled for next week, and she was able to move hers down further. So I appreciate everybody being flexible, and Angela, I really appreciate you helping us out here with this, and Virginia as well. So yeah, so next week will be Dr. Levine, then Commissioner Hutt, and then we're gonna come up with some other people coming up, I believe.
Great.
It's my project for the rest of the week to kind of book out a few of them in advance. So thank you, everybody.
Dr. Levine is still busy answering the same question over and over again on his press conference. The man has the patience of, I don't know what, but yeah. He and the governor both. So just want to start off with any brief announcements that people might have. And I'm going to call on Janet Hunt because I read a great editorial from V4A this morning. And if you wouldn't mind, Janet, sharing a little bit, not everybody probably knows that news about, how memes can help us deliver meals.
Right, sure. Thank you, Representative Wood. Yeah, absolutely. The release has gone in the digger, so you may be able to catch it there. But we were all thrilled the end of last week and over the weekend that Senator Bernie Sanders' sweatshirt, 100% of proceeds went to our Meals on Wheels programs. So we had a call with Senator Sanders, all of our AAA staff, directors and nutrition directors on Monday, I think it was. And he speculated that he's been able to raise through that sweatshirt donation about 500 grand. He was very clear with us around some questions related to what do we need for him to advocate on all of our behalf with regard to the Older Americans Act funding. What do we still need to try to take care of that gap that we've been advocating for years related to the cost of the meals versus what we get funding for. And we're still, despite the fact that that was a wonderful gift, a wonderful donation, we still have a long way to go before we'll see a time that we'll be able to just be able to provide 3 meals a day, 7 days a week to nutritious meals for our older adults. So we're still looking at a $4 to $5 gap per meal for each person that we still need to fill on an ongoing basis. But that's it pretty much in a nutshell. I did speak a little bit about the history of Meals on Wheels and the Older Americans Act and how that all came to be. Thanks for talk about that.
Great. Thank you so much for sharing, Janet.
Yeah,
that was a generous donation from the senator and much appreciated.
Absolutely.
And more to the point, the money is appreciated, but the sort of ongoing focus that Senator Sanders has had for older Vermonters and the meals program in particular, but older Vermonters issues in general, it's been a wonderful focus, and having him in a important committee is going to be very beneficial, I'm sure, for Vermont moving forward. So
right.
That's great. Anybody else have any brief announcements that they want to make before we move to our program? And Dan, you're gonna have to call on people because I'm not co-host.
Okay.
I can't see. Raise your little blue hand or yellow hand or whatever color you've got.
All right. Not seeing anybody, but that's okay. Okay. Let's get started. So I thought it'd be great to have kind of a quick update on the adult days. Teresa and I thought that would be a really good way to get started today. And we've invited Virginia Renfrew here, and maybe I'll just turn the floor over to you and and give us an update of what's going on in the adult day world. So thank you for being here. Appreciate your time.
Thank you, Dan. Appreciate it. So I'm Virginia Renfrew, and I'm here today with the Vermont Association of Adult Days. And for any of you who are not familiar with the Adult Day program, they offer community-based, non-residential support where people receive a range of professional health, social, therapeutic, and nutritional services. And they also provide respite, support, and education to family members and caregivers. And these services allow for significant savings to the state, enabling Vermonters to age at home instead of in a nursing home or assisted living residence. Before the pandemic, there were 13 adult days around the state. And since the pandemic, we have had 3 adult days closed permanently. And that was in Barre, Rutland, and Newberry. And since the middle of March, all programs have been shut down. And this has been very challenging for the adult days to remain solvent, especially being fee for service. So early in the pandemic, the adult days wanted to make sure that they could connect with their participants, the families and caregivers. So they started up basically what they've called Adult Days Without Walls. And what this does is they have these virtual services. They're in communication with their participants and family and caregivers. They do Zoom chats, activities, and trying to keep people stimulated and knowing that, you know, someone's out there and staying in touch with them. One of the things with the adult days was the recognizing that they needed to get, you know, financial help. And so in the beginning, they all received the Medicaid retainer payment through DEVA. Some applied for the PPP loans and a few of them applied for the IDL loans. And thanks to the legislature, they were able to get CRF funds, which totaled about $4.4 million. And this was really a lifesaver for them and has enabled them to stay viable and still hang on to their staff and be able to reach out to the participants and the caregivers. So when December came, all the money ended. And so now we're into January, and some of them are very concerned that without some more financial help, that they will probably need to permanently close. I'm happy to say that in the budget adjustment that the House will be taking up tomorrow, there is language in there which allows the Agency of Human Services to use funds that are in the Healthcare Stabilization Fund to help the adult days. And so we are hopeful that the budget adjustment will move quickly through the Senate and be able to get some help out to the adult days, because they are such an important piece to the long-term care system of Vermont, and losing them would definitely be a great loss to the state of Vermont. So I'm happy to ask and answer any questions. And
I'm just wondering, as an update for folks, Virginia, it might be helpful to let folks know what's going on with the budget adjustment that we'll be voting on this week in terms of language.
Right, so there's language in there. So I'm not sure if you're all familiar with the Healthcare Stabilization Fund has CRF money in that, and that was set up by the legislature to help healthcare providers across the state. And I believe when it was first started, it was about $275 million that was in that Healthcare Stabilization Fund. Now that we've heard from the federal government that we don't have to return the money at the end of December. There's still, from my understanding, approximately $10 million in that healthcare stabilization fund. So there's language in there in the budget adjustment that says that the Agency of Human Services may use, and it's a may, it's not a shall, may use the money to help long-term care facilities who have had impacts from COVID, and also may use it for stabilization of the adult days.
Great. So while there's not specific dollar amount listed there, which we were hoping for, to be honest, and advocating for, we are hopeful that the Vermont Association of Adult Day Services will work collaboratively with the Agency of Human Services to help keep this as a resource going forward, keep these services and programs as a resource going forward. One of the points that I've tried to make in this is that just as we have shored up the childcare system to ensure that that system was there post-pandemic and during pandemic, the exact same needs are necessary for older Vermonters to ensure that we have a community-based support system for people as we weather this pandemic. So thank you, Virginia, and if we have any, yeah, go ahead.
I'll just add that, we have certainly been in communication with Dale, and, Dale certainly has been supportive of the adult days. And so we've been, as this has been moving through the legislature, having those conversations with Dale. So, and I did see that Steve O had a question. I don't know.
Yes.
We also have we have a couple, so we'll start.
Why don't you go ahead and call on them, Dan.
Hi, Virginia. This is Steve Ovenden with RSVP Senior Volunteers. How many adult day centers are there in Vermont?
At this time, there are 11. There were
how many?
There were 14, and now there's only 11.
And do you know about how many people they were serving before COVID hit?
I don't know the answer to that. I'm sorry.
Okay, thank you.
Jane?
Hi, everyone. I just wanted to echo Virginia's sentiments around the importance of the adult days, certainly from the Area Agency on Aging's perspectives at Age Well, certainly, and others. I know we have conversations about this, but our ability to provide supports through our care management programs are really center around the adult day programs. So when those programs have closed or paused even during COVID, the impacts on our clients have been substantial to the point where they're not receiving the necessary socialization or just being able to get out of their homes, because sometimes those clients, those older vulnerable adults, go to adult day because they need to be cared for during the day when there's no one else available. So this has had a huge impact, and I think they're really part of an important network, and we have to sort out ways to be able to continue to fund them through different means or systems.
Great, thank you. Okay, so all right, looks like we'll move on to our next topic here, which is the Older Vermonters Act. This was a bill that we passed last session, right? Pretty much at the end. It was good to get it across the finish line for sure. And there was a bunch of stuff in that legislation, and it'd be great to have an update on where it stands and what's going on. So we've got Angela Smith-Jang here today from the from Dale. So I don't know if you want to add anything, Teresa, but we can turn it over to her.
Sure. I just want to say one to the legislators who were on the call. Thank you for your support of that bill last year, if you were here. And that it really is a far-reaching bill that involved a lot of different people's input, and that really is trying to set the stage for Vermont to become an age-friendly state that goes across really all of our state and all of state government. So while Dale is a lead player, and that Dale is the, I'll be, probably most people on this call know what Dale is, but Department of Disabilities, Aging and Independent Living. We were reminded in our last Zoom meeting that we should try to be free of acronyms for people who may be listening on YouTube who, or people who are participating who might not know all of the acronyms. So I will try my best on that. So with that, yes, we would love to welcome Angela, and thank you for being here to give us an update on where we are in terms of implementation.
Great, thank you so much. Happy to be here with everyone today. My name's Angela Smith-Jang. I'm the Director of the Adult Services Division here at the Department of Disabilities, Aging and Independent Living. And we were very supportive of the Older Vermonters Act and its passage last year, recognizing we have a lot of work to do in terms of implementation, but it's all really good work. So I wanted to share a little bit about where we're at. I'm hoping to be able to share my screen, if that's okay. Oh,
yep, I think
no,
can
you help me do that, Dan?
Yep, I think we can. Now you are a co-host.
Oh, okay. Okay, great. So I just wanted to pull up the few slides that I had put together. Are folks able to see this?
Yep.
Great. So as Representative Noyes and Representative Woods said, the state passed the Older Vermonters Act last year, and the work has already begun to start that implementation for sure. There's a few different components of the bill that I wanted to touch on today with folks. First being from Section 1, the work to promote principles for a system of services, supports, and protections. That's kind of the sort of heart and soul of the bill. The work we're doing around the next state plan on aging that's outlined in the bill. Adult protective services, the work towards the Vermont Action Plan for Aging Well, and the self-neglect work group. So each of those were different pieces of the bill that I want to touch on now. First, I wanted to share this graphic of the principles from the bill. There was a group called the Older Vermonters Act Working Group that provided recommendations for the act to the legislature, and that group worked over the course of a year and a half or so and really focused on these sort of guiding principles for the act. So really looking at self-determination and safety and protection, both being key to ensuring that we're all able to age well in Vermont, and then looking at the many components of what that means to be able to age well. So we all want financial security, optimal health and wellness, social connection and engagement, housing, transportation, community design, and strong family caregiver support in this overarching system that is coordinated and efficient in terms of providing services. So these are our goals and our aspirations and what we're truly working towards as a state. And so, you know, in first steps, in sort of initial steps, we really want to be able to promote these principles across state government, across community networks, ensuring that there's really broad understanding and awareness of what we all are looking for aging well in Vermont. So that's sort of number one. Happy to share these slides too afterwards if that's helpful for folks. And then in terms of additional updates, on this for the next state plan on aging, which will not actually go into effect until federal fiscal year to 2023, which would be October 2022. But the work in planning for that next state plan on aging has already begun, initially with a survey of older Vermonters and family caregivers. So that was done last fall. And we have the results of that survey in a report that's on our website. So I included the hyperlink. It's a really comprehensive report. If you have a chance to sit down with it and you like data, you can just look at the executive summary, or you can look at the details. But there's a lot of good information there in terms of what older Vermonters and family caregivers, what their current needs are, as well as what they're thinking about for the future. And we had over 3,000 people respond to that survey. So it was a really great response rate. That's sort of step one in our needs assessment for the next state plan on aging. There's a lot more work to do in the next steps of the needs assessment outlined in the bill, really doing a comprehensive environmental scan of the demographics of our state, of the resources available, of the programs we currently have, being able to prioritize those and kind of doing an evaluation across our LTSS, our long-term services and support system for older Vermonters. So lots more to do there, which is why we have about another year of that needs assessment work to go before actually drafting that next state plan. The next section of the bill included Adult Protective Services, that's APS, a report submitted to the legislature. So now codified in statute is a requirement that Adult Protective Services report to the legislature annually on people served, reports submitted, the kinds of investigations that are done, et cetera. So that report was submitted this January and is linked here as well. Then the next piece is the work towards a Vermont action plan for aging well, which is designed to be kind of even a little bit different than the state plan on aging, in really looking out across all sectors of Vermont and bringing in the public health approach as well, and really creating sort of a blueprint for our whole state, a master plan, that kind of thing. And so the first step in doing that is that the Agency of Administration needs to put forth a proposed process for the development of the action plan. And that proposal is due to the legislature this May. So Dale and Department of Health are working with the Agency of Administration on that process. There's a draft proposal for that process, and it's ready for stakeholder engagement. So another component is that there needs to be really strong and collaborative engagement of many different partners in building out what that process will look like for creating this action plan. So that engagement will mostly take place in February through meetings and public comment. We'll definitely post the draft and opportunity for comment on the Dale website. And then finally, and I'll just say one more thing about the Vermont Action Plan for Aging Well. So this first initial step is really around just creating the process for the development of the plan. And then there'll be a whole nother set of next steps after that for actually creating the bigger plan, which we hope will align with the state plan on aging, as well as other plans like the state health improvement plan and those kinds of things. Finally, the self-neglect working group was also created through Act 156. And I anticipate that this working group will be able to launch in about April. It's required to submit a report to the legislature by next July of 2022. So we want to get it going soon, because self-neglect is a really interesting but complex challenge facing Vermonters, and it really requires a really collaborative response from government, community providers, and everyone. So there's a designated membership for that working group, and I think outreach to members will begin next month to hopefully be able to have that first meeting in April and really give the group the time to come up with the recommendations as outlined in the act. So I think that those are the updates I wanted to provide at the moment. Let me see if I can stop sharing my screen, but happy to take questions or open it up for discussion.
Angela, could you maybe elaborate a little bit more about how you're engaging older Vermonters themselves in this planning process and moving forward? I've seen some of the posts and the opportunities to provide feedback into the development process, but I'm just wondering how, and it mostly seemed like it was going out to organizations. Could you explain a little bit about how you're reaching out and how we might, as legislators, pass along information to our constituents about the ability to be informed and participate?
Right. So are you speaking specifically around the action plan for aging well and engaging in that process?
Yes, that's the one. Yeah.
Yeah. Great. Yes. So right now, the invitation for the first meeting did go out mostly to representatives of organizations working with older Vermonters. We kind of use the Older Vermonters Act working group as our kind of foundation in terms of who to start with. But Act 156 does require that we reach out to older Vermonters themselves as well, and family caregivers for that engagement process. And so I think we'll need to work together to be able to do that through the area agencies on aging, through the senior centers, through you all as legislators. So being able to put that draft online and then sending out the information for people to be able to share comments in multiple ways. So we may be able to offer an additional sort of online meeting like this. We'll certainly accept written comments and can accept comments in other forms too. Does that help?
So I guess maybe to summarize, what I'm hearing is that it's a work in progress.
Yes, indeed.
Okay. I think it would be helpful, people have become very adept, and in some ways our government and our opportunity for input is more accessible as a result of this pandemic by, having electronic means to communicate easier. And so I just would really encourage an opportunity around the state for older Vermonters and family caregivers to be able to, in their own voices, to give input to Dale and the health department in this process. And I know it's really important to be able to do that through the voices that also represent older Vermonters, but it's also important to hear from people directly, I think. Yeah.
Yes.
It looks like Meg has her hand up.
Yeah, and I just wanted to add or remind that we learned a very valuable lesson in the needs assessment, because using a paper survey that went out to all of our home delivered meals recipients provided some information that we did not receive from the people who filled out those surveys online or who were tech savvy enough to communicate that way. So it's really important that we understand there's a portion of population that is not ever going to be on a Zoom call or respond to an electronic survey.
Definitely.
Thanks for that reminder, Meg.
Yeah. I see Ruby.
Sorry, I seem to not have a digital hand, but I have these great physical hands that I'm going to use. I was just, I'm sure that Angela is already thinking and talking about this, but I wanted to ask or highlight that during COVID and in this unique situation that we find ourselves in, how do we leverage the Older Vermonters Act and that action plan for aging well to really build a system that is more resilient and more comprehensive and stronger than what we went into the pandemic with? Because everyone here in this room knows that what we had before was not a perfect system and was arguably a declining system with significant functionality challenges, and now we've had to address some of them through emergency funding. I'm looking at the adult days. I'm thinking about Meals on Wheels, access, telehealth. These are all issues that we've had to address in sort of this emergency moment. But post-emergency moment, how do we leverage this act to bring those needs of older Vermonters to the forefront?
That's a great big question, Ruby. And I'm right with you there in terms of thinking about it. Certainly in the Adult Services Division, one of the things that we're really focused on in 2021 is looking at really giving ourselves the time to reflect on everything that happened in 2020 and continues, and learn from that, really, in terms of many of the things that we were able to do in terms of policy flexibility and funding flexibility, maybe things that we want to continue because they do strengthen our system overall. One example would be being able to offer some services through the telehealth model, or in a way that has been successful for some people, not for everyone. So we really want to be able to continue to provide a variety of services in a variety of ways to meet the needs of everyone going forward. So I also think, older Vermonters are now on the radar of many people in community and in government and in the, philanthropic sector, that in a way that may not have been true pre-pandemic, and people are really recognizing the importance of focusing on the needs of older folks. So I think that we can leverage that moment as well for more long-term opportunities for more systemic change, right? And certainly the principles and promoting those principles will be forefront in that work. That really kind of needs to continue to be our guidepost as we go forward.
Can I ask a follow-up question? Is there any discussion around payment model reform for HCBS and other adult services?
Payment model reform, is that what you're asking? Yes. So it definitely, in the context of the challenges that the adult days have been facing, payment reform is something that is becoming very clear, needs some attention. And actually, I have a meeting next week with the Director of Payment Reform in the Department of Vermont Health Access, specifically to talk about initiating some of that work around the adult day centers, and obviously working really closely with the Adult Day Association and the centers across the state to see where that might go. It's a big endeavor to undertake any sort of payment model reform, but I think we're recognizing that that's really what's needed long term, and we, no better time than the present to get it started.
Angela, I'm just wondering, I know that one of the things that we have coming up is the renewal of the Choices for Care as part of the global commitment to health waiver with the federal government. And I know it's all these things sort of are interrelated as we think about going forward. And you know, one of the things that that I'm wondering about is, are you anticipating any changes? Are you anticipating any changes as we go forward in the maybe types of supports or the modalities? Like, for instance, continuing to allow Medicaid reimbursement for telehealth, you know, things that we've done. You know, you seem to indicate a willingness to do that. Are those kinds of things going to be present in the application that goes into the federal government for the global commitment renewal?
So I'm not sure that I'm the best person to answer that question.
We can save it for Monica for a couple of
I might push that out to her, but I do believe that that's part of this conversation. Absolutely, considering some of those things.
Great, and that could actually be a whole topic. We could talk about that, I'm sure. Are there any other questions? I'm trying to watch for any hands or virtual hands or real hands. So if you've got a question or comment that you want to talk about, we'd love to hear it.
One of the things that I wanted to follow up on was something that Angela said, and one of the other folks who asked a question or made a comment, is the opportunity to take this moment of heightened awareness of our older Vermonter population, both those who are receiving supports in long-term care facilities and those who are receiving community supports and those who are not receiving any supports at this point in time. And that is something that we really need to capitalize on. And even things about accessibility of things like accessing vaccinations. That one's on everybody's mind right now after, you know, the launch of the 75 plus vaccine website earlier this week. So, you know, I'm just looking at my fellow legislators to carry this message in the State House. You know, we are often asked to continue to carry messages about keeping in mind how legislation that we have or that we propose affects different populations, whether, you know, it is, you know, people of color, or whether it is other minorities in the state of Vermont. We need to also keep that in mind for older Vermonters and how things like, you know, what's going on in transportation committee. You know, there are all sorts of issues that pop up there, or access to voting in our general housing, in our government operations committee, or we just came from a housing testimony, and this is Homelessness Awareness Day, and the number of older Vermonters experiencing homelessness has taken a rise during this pandemic. And those are all things. It's almost like when you talk about older Vermonters, every single committee has a role to play. You know, our Energy and Technology Committee, you know, access to broadband in some of the most rural parts of the state. You don't get access to telehealth and some of those kinds of things unless you have good service. So, so I'm just asking fellow legislators, spreading the word, to think about older Vermonters and caregivers when we think about legislation that is getting discussed in our committees. Any other thoughts from folks today, either about adult day services or about how we're moving forward with the planning process from the Older Vermonters Act?
Yeah, this is Connor O'Day with the State Unit on Aging within Dale, and just echoing what Rep. Wood was just talking about. And really, I think I'll just say specifically family caregivers is something I think we're really going to have to keep an eye on, especially moving forward in the future. We know that during this time, family dynamics have changed, with older Vermonters taking many precautions around their communities and having families come in to provide more assistance, whether that's very light from grocery shopping to maybe a more heavy-handed type of assistance in terms of transportation and other involvements. But we know from looking at trends with family caregivers is that's where it starts. It's something very light. It's they might not even probably recognize themselves as caregiving. It's just, I'm helping mom out, I'm helping dad out. But that again is where it starts. And we don't know quite yet what families are discovering now that they've had this increased amount of contact and support with their parents. There could have been things and that as they become more active, they realize mom or dad does need more help than I originally thought, or things that they didn't pick up on over the phone or just in their monthly contacts of, oh, geez, there's more going on here than I initially thought. So I think, to Ruby's question about what are we going to look for and what are we going to learn from this, there's still things to learn. And one of the things we're really going to be having to keep a close eye on is how does this impact our family caregivers? And how does that tie into the workforce shortage that we have and that increased weight on the shoulders of the natural supports? So we're, that definitely in tandem with the older Vermonters is a specific population that, again, is hard to identify because they don't necessarily self-identify, but just in terms of how we interact with people and, trying to get our primary care physician to our AAA network to really being able to try and find these people in the community who over this last year have had to increase their the amount of time they're helping their parents and what that means for their health and the impact that it has on them and providing the support that we're able to. So it really ties in together with our adult day and what we're talking about, but just to specifically call out that population.
Thank you, Connor. That there is, a precise example of that. And, we know for a fact that, there have been, unfortunately, dozens of people who have left their home communities and are in residential care now of some sort of long-term care as the result of not having the kind of supports that they had pre-pandemic to provide that family support to them as caregivers. And those caregivers have experienced an immense amount of stress and, had to make a decision at some point in time, with their family member. And that is something that really sort of breaks my heart because I know it's not a decision that folks made lightly at all. So the importance to us is not only just about our communities, but it is also about, for those people on the call who are concerned about the fiscal stability of our state, it is also about resources because we can provide many more supportive services in the community than we can for the same dollar that we spend in long-term care. And long-term care is, a necessary element in our array of supports and services. But I can guarantee you from surveys that have been done, people prefer to be in their home communities with their families if at all possible. And it makes good economic sense for the state, and it makes good sense for families in our communities to have people in their home communities for as long as possible. So, we have data to show that has been an issue for Vermont, and I'm sure an issue all across this country in the last year. I see Molly unmuting herself. Go ahead.
And I got a couple questions here in the.
Okay. So. All right, and we're going to wrap up in the next 5 minutes. So.
Yeah.
Okay.
So
thank you.
I guess Molly, Jim, and then yes, Ruby.
Wonderful.
Go ahead, Molly. Thank you.
Thank you so much. I'm Molly Dugan. I'm with Cathedral Square, also with the SASH program. Representative Wood, thank you so much for mentioning that, that continuum of supports in the community. And I just have to bring up the fact that what we did not see in the governor's recommended budget that came out yesterday was an increase in Medicaid reimbursement for home and community-based services, including res care and assisted living. And that's very concerning. As you guys know, we didn't have a increase last year either. And after, especially everything that we've all been doing in that part of the equation on continuum of care with COVID. It was just very surprising and honestly disappointing not to see some increase in the Medicaid reimbursement for ACCS. So anyway, I feel like I had to bring that up. The other thing I wanted to mention, and Connor, I really
ACCS, Molly, just say.
Oh, I'm sorry. Is the it's the Assistive Community Care Services Program. It's the Medicaid funding for that. So sorry about that. I'm not even sure that name actually helps, but that's what it is called. And then Connor, I just thank you for what you raised as well. And I can't help but also just add to that one of the things that we found, especially with our SASH participants that are across the state, embedded in affordable housing and in neighborhoods, is just the increase in mental health challenges. They were there before COVID, but the social isolation that has been illuminated and strengthened, unfortunately, through COVID has really added to those challenges. So I think we also have to be thinking about how to provide even more support around mental health to older adults. Thank you.
Thanks. Jim? Oh, you have to unmute. I think I can do it.
Yep.
Nope, you got it.
Wasn't fast enough. Thanks.
Beat me to it.
So I'm curious, with COVID and potentially a decline in adult day, isolation becomes more of a concern, and I'm just wondering how does the state hope to improve things like the broadband and that sort of thing with I mean, as people use Zoom more and more, we're seeing that places need to up their speed and up their capability, and we certainly see that people who are in less broadband served communities have a harder time staying connected. So how does all that come together?
Definitely going to be taken up in our Energy and Technology Committee around making sure our communication union districts have some funding to, you know, I've reached out to Tim on that, to the chair. And so, yeah, definitely.
I know it's been a hard nut to crack all along, and I think isolation makes it more of an aging issue than it ever has been in the past. So thank you.
Yeah. And we'll wrap up with Ruby.
One of the things, just as Jim mentioned broadband, I just wanted to further highlight that I think it's important when we talk to each other about broadband, that it's not just about working people, it's not just about school-age children, that it's really about older people are dramatically affected by this as well. And that's an important point to make when Energy and Technology takes this up and starts talking about it. So I think that's a space where we need to advocate for older adults and the role that this plays in their lives. But what I really wanted to say is going back sort of to what Molly was getting at earlier about how frustrating and disappointing it is now to see 2 rounds of budget without an increase. And you know, last year in the Older Vermonters Act, there was unfortunately a section taken out that would have provided for regular annual rate reviews and increases. And the argument from the Appropriations Committee was that they've given increases of 2% every year, and that might be better than what some of the nursing facilities see, which is not always 2%, and that they've done it every year and they want to have control over that. Well, now we're looking at you know, possibly a second year where they haven't done that. And I think that further raises the point and the necessity to build a rate review process into how we deal with Medicaid reimbursement rates, because it doesn't always happen. And it is incredibly harmful to those programs and those systems when we don't offer increases that at least allow them to attempt to keep pace with the increased cost of living, the increased wages, and just the cost of doing business goes up every single year. And it's a huge problem that we attempted to address and was sort of cut down in its infancy. So I just would remind all of the representatives here in the room that that's important, and know those 2% increases don't always come through, and they are vital to our system. And if we want to have a system, we have to build in a way to support it.
Yep.
And Ruby, just to on Ruby's point and other folks' points, it was cut down but not out. There still is a sentence in there that has the intent that we do review it, and we'll be meeting with the commissioner to indicate that that is something that we want to have happen sooner rather than later. We do have a bill coming out about that again this year to provide additional focus. And like Molly said, I too was disappointed that the governor's budget, given the stress on long-term care facilities, did not at least address that. There is money in there for nursing facilities, but we have many more long-term care supports and services than those just provided in nursing facilities. So Dan, I'll pass it back to you to wrap this up.
Great. So thank you everyone for coming today. And I will follow up with sending out Angela's presentation along with the survey that Meg spoke about. I thought it was some pretty good information in there. So really appreciate everyone coming and looking forward to seeing you all next week. Thank you.
Thank you.
Thank you.
Thank you.